Hi, my name's Phil. I like talking about politics. And I know I said that September would be a politically hot month, but my goodness, it's coming thick and fast. So fast that there are really important topics that I want to discuss that have been delayed as something I can defer until later. But something that's really important right now is the implications for the COVID pandemic in Britain as a result of schools going back in England and Wales. They went back in Scotland earlier, and the results point to a worrying picture. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. Also first, or I suppose second, people may or may not be aware of 16 Million Rising, which is a pro-European broadcaster that is running a special where listeners are invited to send in short audio clips for causes they'd like to champion. I sent in a 1-minute clip as part of the effort. Link below if you're interested in checking out the next show, which I think is tomorrow. But anyway, back to COVID, and in general terms, it's all looking a little bit sticky. Before we look at what's happening in Scotland specifically, let's check out the international picture. New Zealand, which famously adopted the zero COVID strategy common to a lot of Pacific nations, had a bit of an outbreak. Barely anything to even talk about by the scale of our outbreaks, but they had one and stamped on it. They got an immediate reaction and it's now in retreat. Kit Yates, who's a mathematical biologist who's been discussing a few things regarding the pandemic over time, pointed out that plotting New Zealand's surge on the UK scale makes it invisible. It's like, what surge? Sure, difference in population, but the UK has a population 13 times the size. Not enough to hide New Zealand's surge, all things being equal. Right now, New Zealand has an average of no deaths a day. In the UK, it's 140 deaths a day. That's infinity times more when approximated, but even if you throw in a few decimal places, our rate is way out of proportion to our extra population. You know, if it was similar, New Zealand would be having over 10 deaths a day. Now, when compared to some of our European neighbours, it still looks ropey. You know, Europe, by and large, got things wrong, didn't adopt a zero COVID approach, but yet we still stand out as a beacon of, what are you doing? The third wave in decline in all these countries at the moment, on the rise in the UK. Might this be because we cancelled all mitigations? You know, I drove into Scunthorpe earlier in the week, and I've not seen the roads so busy since before the pandemic. This wasn't just schools going back. You know, I've experienced that traffic during the pandemic. This must have been way more people travelling to work to go to the office as well. And all of this is worrying enough on its own. But then we consider the impact of schools reopening without the kids being vaccinated and without even the piss poor mitigations that we had in place before summer, which in themselves weren't enough. There was an interesting thread from Professor Christina Pagel on the Scotland situation. Scotland removed the remaining lockdown restrictions in early August. There was an immediate surge, looking at the graph, which is to be expected. Of course, if you remove restrictions, you will see a surge in infection rates. It's not a reason to remain in lockdown forever. I understand that isn't feasible. As far as I'm aware, Scotland does still have some mitigations in place. Correct me if I'm wrong, but face masks are still required in certain indoor settings. But then schools returned. The surge exploded. Note that this graph is for 15 to 19-year-olds. We're looking at those who are now packing into close confines for hours a day. The rate seems to have fallen recently, but is still way higher than at any time so far during this pandemic. Now, the reason for the surge is obvious. We've jammed a load of unvaccinated people into close confines for hours a day. What's the reason for the fall in the last week? Could be down to the large numbers of kids absent from school. In many cases, COVID related. So the fall in infection rate, you know, if it is driven by 13% of kids in Scotland not actually being in school, is coming at the cost of 1 in 8 kids not getting their full education. More schooling being badly disrupted for a third academic year in a row. Now, for under 15s, the rate shot up after returning to school, and that hasn't come down yet. It's sort of levelled off a little bit. And it's not just cases either. Too many people just think that there's a whole section of society that will just catch COVID, feel rough for a bit, wonder why they can't taste their curry, and then get better and get over it. And they lump in, younger people into this group. This is not the case. Long COVID is an incredibly worrying prospect, but even hospitalizations are shooting up. Yes, of course, the chance of an individual, if you look at an individual healthy child or just young person becoming seriously ill with COVID is way lower than for an older person. But if you infect enough children or young people, that smaller percentage still translates into a lot of kids in hospital. And it is doing. Hospital admissions for under 18s in Scotland also shot up way beyond anything we've seen before during the pandemic. And we also have to bear in mind the risk to having few, if no mitigations in schools and jamming them all in is not just to the kids in the schools, and we're not even just talking about teachers who may be older, but the people they go back to in their households. You know, we're too blasé about things because of the vaccination programme, which has barely touched this age group. And here's the really big problem coming our way. Pagel pointed out that the consequences for Scotland are clear. Kids have just gone back in England. We already had a high rate of transmission to start with. So it's not like we had a low rate of transmission and any little outbreaks we can stamp on them. It was already too high to cope with. And we have even fewer mitigations in place. We have virtually none. We have an education secretary who is so sharp and on the ball that he met the Londoner rugby player Maro Itoje and thought that he was meeting the Mancunian football player Marcus Rashford. He tried to defend the mix-up by suggesting, because one of them, Itoje, for example, is trying to get more IT for kids, and Rashford is trying to actually feed them, you know, and he tried to defend a mix-up by saying, he gets these campaigns mixed up. He gets a campaign to get laptops for school kids and one for feeding them at meal times. It's easy to confuse. I'm always confusing computers and food. Right, we're on for a winner here, aren't we? Basically, we're making a right out of things right now, and when it all goes tits up as if it hadn't already, don't expect the cabinet minister in charge of schools to act quickly or decisively. He'll probably get mixed up between COVID and a bowl of sugar puffs. We have hospitals reporting critical shortages of space already in summer, right now. Oxfordshire hospitals were describing themselves as being in a critical position in the last week. And this is summer. Before the pandemic, we were already having to get used to hospitals collapsing during winter. During the 2019 general election campaign, people seemed to ignore the fact that we had patients not just on trolleys in corridors, because of a lack of beds, but on the floors of corridors because we also ran out of trolleys. Somehow people thought that the party that spent 9 years at that point, getting us to that point, were the people to trust with our healthcare. Nothing that has transpired during this pandemic should really come as a major shock. But imagine what this winter is going to be like. We know from pre-COVID winters that even without the pandemic, our NHS has been so badly undermined by the Tories, it cannot cope with a normal winter. We now have a situation where some hospitals at least aren't coping during summer. What on earth do we expect is going to happen this winter? I mean, apart from the government and media doing their best to hide the devastation from the general public, or where they can't hide it, blaming it either on young people or the party that hasn't been in power for 12 years and never saw scenes like this. I mean, just look at how effective their campaign of misinformation and distraction is doing right now. We have 1,000 people dying a week from COVID in summer. 1,000. We have no real government mandated measures in place, meaning that ministers are giving people the impression that we are managing without them. 1,000 people a week dying is fine. That's where we are right now. Looking at government data, in 2018, 40,000 people died from ischemic heart diseases. That's an average of about 770 people a week. That is the subject of frequent campaigns by the NHS and the government because that's a lot of people dying and that's far too much to do nothing about. COVID is killing way more than that right now, with a vaccination programme in full swing and without us even being in the season where you'd expect it to be worse. And what is the government campaign to deal with this death toll? Misinform and distract. I said right at the start of this year that come the autumn, COVID would be biting hard again. Never mind their vaccine boost, that alone was never going to get us through this. The government were going to face a reckoning this autumn. Didn't know about the Delta variant then. Don't even know if a worse one will start dominating. But I knew that this government can't govern. What needs to happen now is for people to actually start getting fed up with this constant lies and excuses, to actually look at themselves and go, Do we think 1,000 deaths a week is fine? What happens when it gets to 1,200, 1,500? What if it gets to 2,000 a week? Goodness sake, what then? You know, so we have to get fed up with this, decide that we're not accepting the excuses, or we'll never get on top of things. The poor preparation for this September is already going to cost us dearly. But those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.